And to practice meditation in a formal way, I find that it helps to have to follow a certain sequence. So, and there's a lot of benefits to rituals. Our bodies like rituals. We like to, our body likes to know what's going to happen next. So a little bit like the sleep ritual, if you have the same pattern every night to go to sleep, then you're going to be able to fall asleep more rapidly. So it's the same with meditation. If you follow the same ritual every time you prepare yourself for practice, oftentimes your body will know what's coming next, and it will be easier to go into that state. In order to be able to sit in a formal meditation practice or lay down in a meditation practice, we need to first be able to relax our body to promote a sense of relaxation. And this may not be as easy as it sounds, because for most of us, being still can be very hard. It can be a very big challenge. That's the number one, actually maybe the number two fear that I hear from my patients when we talk about meditation. The first fear being that they often think that it's the cessation of all thoughts, and that they often think that they need to be religious or have a spiritual practice. Or so the third one is or second or third, depending. It's often my patients will tell me, well, I can't sit still for 5 minutes. I'm gonna go crazy. So we know that for certain people, being in that safe immobility, as we saw in the polyvagal theory, may be very hard. So we may need to start with informal meditation or a walking meditation or other types of meditation. But then slowly we may want to bring them to be able to be just relaxed in a state of immobility. And oftentimes I find that the way that I'm going to start is by doing a short body scan, which we'll do together in the practice section, so that the person can learn to relax their body. It can be through different techniques as well. If you've learned progressive relaxation, if you've learned like the contraction and relaxation of your body, methods to relax the body, those can all achieve that state of relaxation. For certain people, they may like to do more of a vigorous practice before, then settle down, then do the relaxation practice, the meditation practice. It really depends on how the person is able to relax their body. So that's also why I suggest that you always do these practices with your patients before they do these at home, because for some people, laying still for 5 minutes is gonna create some sort of anxiety. So after you've learned how to relax your body, well, and even while you're learning to relax your body, you need to find a comfortable position in order to be calm and still. So like I said before, there's no meditation police. There's no yoga police. There's no police looking over what you're doing. So you can feel free to do it the way that you want. So usually the seat will be sitting in Sukhasana, which is a cross-legged position, sitting on the floor or sitting on a chair with your feet on the floor, and either having your body in front, standing in an erect posture, or laying down. But the difficulty with laying down is that most people will have a tendency to go to sleep when they lay down, because most people are sleep deprived. And so being able to find a comfortable seat that will still promote a state of alertness is quite good for meditation. So it can be sitting cross-legged like I mentioned before, but if it is being in that kind of traditional meditation posture, you may need some cushions under the seat, so that your hips are a bit higher than knees. And depending on the person that we're teaching those techniques to, we have to be mindful of if their body is hurting, then we need to find a position in which they'll be the most comfortable. So we'll need to find a position in order to find calm and stillness. And then the next step is the breath. because we're going to need our breath, or a calm, relaxed breath, to find our meditative state. So if you've done a breathing course either with me or with other people in the past, you may have learned belly breath or a slow rhythmic natural breath. I tend to like starting with the longer, smoother, softer breath from Pain Care You with Neil Pearson. I like to start with that one. People usually respond to it really well. Or the belly breath, but no real focus maybe on breath work at the beginning, just finding a breath that is calming, soothing, and afterwards we can move on to meditating with different types of breaths if that's what the person wants. And then afterwards we're going to need, the fourth step is to shift our point of attention either inwards, so inwards as we've done before in the mindfulness practice, so on your breath, on a point of focus. Oftentimes it'll be a focus on the forehead, like the third eye if you want, or it can be your seat, the grounding on the floor. It can be an external focus as well. It can be a candle or a soft gaze. You can also use mantras, so we'll try them together in the next section. So those will be our point of focus to focus our attention and to be able to cultivate that sense of concentration and attention. And then you need to set up the time that you're going to want to practice for. I find that setting a timer is really helpful because then you're not bothering your mind with the relevance of time and place. You're just setting the timer and kind of committing to the 5 minutes or 8 minutes or 10 minutes that you decided that you were going to do. And when the timer rings, then, or a bell rings, then you know that you're done. You don't need to think about it. And in the clinic, you may want to start with smaller 5 minutes, 3 minutes sometimes, and not necessarily start with like 40-minute meditation. I remember when I started my meditation practices in the courses I was doing, they were asking us to do 45 minutes of meditation, and to be honest with you, I just couldn't do it. It was way too much for me at the very beginning. And even today, I struggle with doing 45 minutes of meditation. I'm not there yet. I'll get there eventually if my body wants to. But I find that setting that timer or having a guided meditation, as we'll do together, I still enjoy guided meditations because that way you can just be guided by the voice, and you don't have to think of, or you have less distraction of the mind. You know what you're doing afterwards. So those are things to think of. And then